older Americans faced an enormous amount of misinformation over the course of the health care debate. It was conscious, it was intended to misinform, and it was intended for political reasons, not for policy reasons. But now that the health insurance reform is law, the world hasn't ended. Older Americans are learning about all the benefits and policies that are working to strengthen Medicare and their peace of mind.
I'm here because I support the Affordable Care Act, and I believe it's important for seniors like myself to understand how the legislation will improve Medicare in the future. I'm a retired dentist, and I've been retired since 1997. I'm pretty healthy for my age, but I do have some cardiovascular problems that require a lot of attention and a lot of expensive drugs to keep me vertical. I followed the health care debate pretty carefully last year, as did most of my friends and former colleagues, and I can tell you that the amount of information circulating in the senior community about health care reform is astounding. Even now that the bill has become law, there's still a lot of information being targeted to older Americans. My most stressful experience was the persistent rumor that health reform law would cut seniors off of Medicare after a certain age. For an older senior with no prospects of getting private insurance, losing Medicare can literally mean the difference between life and death, which strikes such fear in the senior community. I'm old enough to remember when Medicare was first passed. I think it was in the 60s, if I'm not mistaken. When was it?
65.
1965. And at that time, I remember so vividly, the exact same arguments that I'm hearing now, of course, from a younger community, because these people, now that I heard it from, may not still be practicing. But at that time, I heard physicians say, oh, we're going to go broke. The government is going to tell us what we can charge, what we cannot charge. And some of the older citizens said at that time, well, what are they going to do about me? I'm old, I'll never be insured. All of the same arguments you hear now. And those people, many have retired. I knew very few who, because of what happened there, gave up their practices of medicine. And I know very few people who did not benefit. I don't know any who did not benefit for the Medicare law. I'm hearing the same thing now, and I hope I live long enough to see that part of the community still stick to their guns and benefit from the bill. There are a lot of reasons why I believe that Affordable Care Act will be good for Medicare. And I also believe it will be good for my family, and that's a thought I'd like to leave with you today. So many people ask me, my friends who are one of the anti-groups, who will say, what is it going to do for you? Why are you so much in favor of this bill? I said, well, I'll tell you two very important things it's going to do for me. Number one, it's going to allow me to live out my life. It's not going to live me, I don't like to use the word, to be my life to be judged by a death panel. That's baloney. Is baloney okay to say for this? Baloney. That is baloney. And the other reason I give them is this. We have a granddaughter, Min is in the audience, who is at the age of 3, had a malignant brain tumor. She was operated on. She's gone through treatments all of her life. She's now 25 and functioning fairly well, but still under the care and treatment from time to time. She's 25 years old. She's been taken care of on her parents' health insurance. Now, without this bill, what was going to happen when she was 26? When they cannot find a job for her that has health benefits to pay that? When she could not have it any longer under her parents' bill, under her parents' insurance? She would be cut off without insurance at the age of 26 and be faced with the terrible, terrible dilemma and challenges to her going on in her life. Now I can say that she can, with this bill, that she can get health insurance and they will not be dependent on any pre-existing conditions.
We're here today to draw attention to a critical piece of mail our seniors will get this week. This 4-page brochure outlines the new benefits and health reform for Medicare recipients. Perhaps most significantly, it begins with what stays the same for Medicare. No change in guaranteed benefits and no change in eligibility. During open enrollment this fall, seniors will continue to have a choice between original Medicare and Medicare Advantage. Medicare will continue to cover health costs the way it always has for seniors.
There has been a lot of misinformation promoted about what the Affordable Care Act will and won't do, particularly as it regards seniors and their benefits. And unfortunately, some of that has distracted from what are the real benefits available in the new law to seniors. At the Department of Health and Human Services, it's our responsibility to get the word to seniors about what the facts are involving this critical benefit program. And as part of that mission, we sent this week a brochure to the 40.2 million seniors and disabled Americans who enjoy the benefits of Medicare, to tell them what the impact of this law will be on their Medicare program. And I just wanted to outline a couple of those provisions today. First of all, the Affordable Care Act will finally close the prescription drug donut hole, an issue that has been a hot topic for seniors and disabled Americans. It starts this year with seniors receiving $250 checks, and will gradually, over the course of the program, close the donut hole for the 8 million seniors who end up in that category right now, where they are paying 100% out of pocket for critical prescription drugs. Part of the issue, though, we know about the rebate checks is there are already scam artists out and about trying to take advantage to seniors. So we wanted to point out, as part of the brochure, that this benefit is available, but seniors don't have to sign anything or apply for anything in order to get it. Starting next year, in 2011, copays for important preventive care are eliminated. In part, what we know is that too many seniors forego critical exams, mammographies, screenings for colon cancer. We know that there are lots of specific questions that seniors have about programs, and we want to try and answer those questions with factual information. So the 1-800-Medicare number is still very much in work and is updated on a regular basis, and our website at medicare.gov will continue to have Q&A answers, and we will continue to do this outreach to seniors across the country to make sure they understand the elements of the Affordable Care Act and the benefits available to them.